Hello, I'm Dr. Vijay Yevle, consultant pediatrician, heading the Institute of Child Health at the Apollo Hospitals, Navi Mumbai. Today we're going to talk about flu and its prevention in children. Friends, flu is a respiratory viral illness caused by influenza virus. Now there are two families of influenza virus which circulate in the nature, type A and type B. And there are two subtypes belonging to each of these families. So we have four types of flu viruses circulating in the nature. Like your coronavirus, flu virus also spreads by a droplet, and the risk of infection increases when you are in crowded place. And simple measures like avoiding going to crowded places, especially when you are down with flu-like illness, using hand sanitizers and wearing mask would certainly prevent spread of influenza infection. Influenza infections have been there since ages, and apart from using these measures of wearing mask, using hand sanitizers and avoiding crowded places, there is a very effective vaccine which is available to prevent influenza infection. Now, because of this corona pandemic, all of us are pretty well versed with the terms like mutation and new strains. So, influenza virus also keeps mutating, and every year you have new mutants or new strains circulating in the environment. So how does it matter to us? Yes, it does matter, because once you develop immunity, either because of natural infection with influenza virus or because of vaccine, this immunity no longer protects you foolproof, because next year you have a mutated strain of the virus circulating in the environment. Hence, one needs to take this flu vaccine every year. Scientists, they look at the circulating strain of the influenza virus and prepare a fresh vaccine every year. Who all can take flu vaccine? Well, it can be given to one and all above the age of 6 months. The Indian Academy of Pediatrics, which is the body which makes scientific recommendations on use of any vaccine, recommends use of influenza vaccine to all children beginning 6 months of life, definitely up to the age of 5 years, and even beyond, especially in children who have diseases of kidney, lung, liver, blood, or whose immunity is suboptimal. Now, why do we need to prevent influenza in children? Though by and large influenza leads to a self-limiting benign illness, influenza is not equal to your common cold. It leads to very high fever, bad sore throat, body aches, and in children below the age of 5 years and children with chronic diseases of different organs that I mentioned, influenza can lead to complications and may need hospitalization. Complications like pneumonia, your involvement or affection of different organ system requiring hospitalization and prolonged treatment, and at times adverse outcome can also result. Hence, it is important to prevent influenza, especially in very young children below the age of 5 years and in individuals who are at a risk of contracting a complicated illness and where there is a risk of getting hospitalized and adverse outcome. So there is a very effective vaccine which is available, which needs to be given every year because a fresh vaccine is made available. When should a child get influenza vaccine? Well, the best time to vaccinate your child is just before the onset of monsoon, because most of the children in our country, they get influenza during monsoon months. However, there are places like extreme top of our country like Jammu, Himachal Pradesh, where more of influenza is seen during winter months. So you could vaccinate just before onset of winter in these regions. Otherwise, by and large, vaccinate the child as soon as he becomes 6 months with the first dose of influenza vaccine, and subsequently every year just before the onset of monsoon. So let us prevent what is preventable with a simple and effective vaccine. Thank you.